My name's Blake Henderson, and I'm director of the Diffusion of Excellence program. We act as an internal accelerator for emerging promising practices and innovations here at the Veterans Health Administration. We are a massive nationwide network of 170 hospitals and over 1,000 clinics. And at any given time, there's likely people in our facilities who are finding better ways to do things, either incremental improvements, or maybe they could be making transformational improvements and applying certain types of technologies like 3D printing or machine learning. And so for an organization as big as us, it's really important that we have mechanisms to allow our workforce and our employees to come to the table with some of these great new things that they're creating. Shark Tank's important for us because it's a platform that allows us to, again, recognize those most promising innovations, but also at the same time kind of qualify them by putting them in front of prospective buyers or the sharks. And these are medical center directors as well as network directors who decide they want to participate, and they listen to all the pitches and they actually bid resources to bring the practices to their facilities. It's a pretty demanding competition. We usually get about 400 submissions annually, and we have 10 winners.
With 17 veterans a day dying by suicide, we can all agree that one veteran a day is too many. Despite VA strides to reduce that, something's been missing.
VMET is a winner of our fifth Shark Tank competition. Shannon and T-Bone are really exceptional in that they saw a problem in their local community with veterans who are in crisis, and they recognized that VA wasn't quite set up to meet those veterans there in the community. Traditionally, VA police and social workers in a lot of ways had confined themselves to the campus of the VA. But the problem is most suicides and other at-risk events are happening off our grounds. And so working with their facility leadership, they came up with a way to work more closely with our community partners, including local police departments, local social service nets, and to interact with these at-risk veterans, and it's been quite successful. One of the winners of our sixth competition last year is called Remote Temperature Monitoring for Diabetic Foot Ulcers. And why this is important is because diabetic foot ulcers are the precursors for a lot of amputations. And so we've been fortunate enough to partner with a startup in industry named Podometrics, who has invented a really seamless and easy mat that a veteran stands on each day. And it gives us all the information we need to determine if a diabetic foot ulcer is going to form within the next 4 to 6 weeks. It's nearly 100% effective at preventing diabetic foot ulcers, and also near 100% effective at preventing amputations. Innovation has been a part of VA since its inception, dating back to the polio vaccine, pacemakers, nicotine patches, the list goes on and on. But I think what we're trying to do here with the Shark Tank competition and VHA Innovation Ecosystem is really take a set of fresh approaches to innovation at VA by clearly giving our workforce as well as industry a lot of opportunities to come to the table with solutions and great things, and for us to invest in them.